I've been working at Shoreview Dental with the caries management program for about 1.5 years now, and when I first came I was really skeptical of it just because my previous experience at other dental offices, I'd never heard of it before, and so coming on to Dr. Duffin's team, I was introduced right away to it, and after about 2 weeks I was completely sold on it because decay and lack of education is a very real problem, I think, not only in poverty-stricken communities but just in people's lives in general. And I know working at a private dental office, we didn't get to see as much of the problem areas because we didn't see as many children, but now in this office, seeing all the kids that we see, there's always all kinds of sugar, all kinds of lack of education, and bringing these kids in here, it's not only making them more comfortable with the staff, but I feel like we're really giving them good knowledge, and we're not just pushing people through the system and forcing them just to keep their teeth clean without them understanding the reasons why, because a child doesn't get it, and really educating the parents and bringing the children in light of what the parents are understanding, I think is very important. And I think it's also allowing the children to not be afraid of us, of the dentist, of the staff, and just the experience as a whole. I feel like that it's been a very good program. I would highly recommend it to any parents, staff, schools, anything. I've worked a lot with Medical Teams International, and I know that that's a very urgent and emergent type of a dental practice, but I feel like we could avoid a lot more of those type of situations had we have caught this kind of a program ahead of time. So I am 100% for the caries management program, and I feel like it's a really.
Hi there, Omar. How are you today?
Good.
So were you worried about needles when you came to the dental office? Yeah. So why is that? You don't like needles? No? You don't want any needles? Okay, can we paint medicine on your teeth? And it won't hurt? Is that okay with you? Right. Okay. Have you had any situations where you can remember where a child was scared to death, we could barely drag them into the dental office, and over time they changed and they became comfortable with the office and realized that we weren't going to hurt them, and they embraced our approach to care?
Oh yes, I had a little girl about 6-7 months ago. She would stand outside at the door, the entrance door, and hold on to the door and wouldn't release the door handle. She didn't want to come in. Yeah. So now she can't wait to get in my chair and get her sticker.
And get the sticker.
Yes, have me paint her teeth. She comes in with a smile now.
Right. So it took me quite a while to figure out how to communicate with patients about what we're doing, because a lot of times patients expect fillings. They come in with that expectation, and they know that they're going to have to endure a needle and a drill, and so it takes a little bit of education, and I kind of stumbled across the idea of communicating with patients that this is medicine, and the medicine is going to kill the infection in the tooth. And so we've used that message over and over again to the parents, and in some cases the children if they're old enough to understand it. And do you think that has been effective, that they've grasped that?
Absolutely, because I think the worst thing for a parent is to bring their children in and they're scared to death about having a dental appointment, and they know that they're going to be getting an injection, their mouth is going to be numb. When you tell a child you're going to get a shot, it's like the parents have to cope with that child all day, try to, just trying to prepare them for the visit. So when you tell the parents we don't need to use any anesthesia, they're shocked, they're surprised, and they're very interested in it.
Oh, what I take away is huge, because it's a completely different philosophy that surprises me. Isn't more common. I suppose it's the monetary thing, but since I'm into going on mission trips, then I can see hugely how it's needed in other countries. But the clientele you had down at the Shoreview practice, I don't think they're a whole lot different than the people that you meet in a third world country as far as dental knowledge and what they're presenting as far as decay. I spent the last 10 or 12 years trying to relearn dentistry and get on the cutting edge, and no one ever mentioned finding a cure for caries till I came here. And there's a sign in both private offices, and I thought, when I first saw that, my thought was, good luck. I didn't quite see how that would be, but you had mentioned that it was happening here, and then I saw it happen, and the application was so simple, and being here as long as 3 months, I got to see some people where there was actually hard decay that was arrested, basically cured, and lots of family groupings. It kind of bothered me to have the parent in the room. And then having worked here and heard your philosophy and having Leanna help me with that, the whole family is excited about it. I think only maybe 2 people weren't interested in having black teeth. I kind of felt bad for their children because then they have to get the shot, go through the drilling and all that stuff, and it's so much more simple to just solve the problem and have little smiling faces, you know. Completely arrests it, turns it hard. If it's, and it's then easy to fill because you can almost do just kind of scrape it out a little bit, put a white filling in if somebody doesn't want it to show. And the situation of treating root caries on older people or people who are unable to brush, that is just a miracle for them because to do a denture for someone who's 85, that they will never learn how to use the denture. They're just, you know, really in a crisis as far as eating and functioning. And so to be able to treat their root caries or arrest it is just too good to be true. And as far as the children all over the world, you know, when we go to the third world country, I can hardly wait to see what you're going to do. You know, I hope that I hope it really does go like wildfire, like it does. I think there's a lot of dentists who will hear you, because I really think that, of course, we all need to earn a living, but because we're in the care of human beings, I think that's a big part of more dentists than we think, you know, as far as helping people.
What did you notice in terms of sort of our atraumatic approach to care and make the visits pleasant and happy? Did you see maybe that patients' anxieties were lower than ordinarily they would be?
Hugely, because you could say to a child, it's going to be really quick, and it is really quick. And then, you know, they only have to have the bad taste for a little while. And actually, last Tuesday, I put some in my own mouth. Initially, just a little sour, and then just bitter. But, you know, much worse things. Once a child's done it 2 or 3 times, they know what's coming. They can do it. It's, yeah, for even quite small children, because it's not traumatic. It's just like medicine.
Is there anything unique about what we do in this practice that would be hard to be adopted in other offices, or is this something that should be easily embraced?
Easy, very easy. Probably the hard thing for a lot of dentists who are in mainstream type of care would be the fast turnover. You know, they think they have to turn over a room. It goes so fast. I mean, there would have to be some design for a little more streamlined rooms as opposed to a whole full-on big operatory. It seemed like that would make it a little more functional in mainstream dentistry.
When I was little, my mom used to hold me down, and it was scared. I was scared too much, and then when I'm growing and growing, it doesn't feel so scared.
Things are better now?
A lot better. Before, without the medication and everything, she has had a lot of cavities. But now with the change of diet, learning how to change diet, and also with the medicine, it's been a godsend. It's changed so much with her coming here, you know. I don't think I'd be able to get her here if she didn't have this medication with all the drilling and everything. So this is like the best thing, huh, Viviana?
Yeah. All right.
Well, now you're not scared.
We're happy that you come and visit us. Okay. We'll see you next time.
Okay, bye.
Ooh, look at those cavities, they're all dying. These big teeth are coming in, looking healthy.
Stay open, but Juliana. Stay open, okay?
Big one. There we go. Just gonna squirt a little air on your tooth right there. Good girl. Okay.
Open up real big. Big like an alligator. Good. They want me on the other side.
Thank you, honey.
Open really, really big. Ah!
Like an alligator.
Good, good. Ready.
Thumb around in this way.
There you go. In approximate ml. In approximate.
In between.
Aren't I?
There you go.
Hi, buddy. Can you say hi?
So, hello, Sarah and Emerson. Can you tell me a little bit about your daughter?
Yes, this is Emerson, and she turned 2 on August 24th. And we scheduled an appointment for her to get her teeth checked last month. After having 2 of her teeth chip, one right after the other. And when I brought her in, I assumed, that she had weak enamel and maybe it was hereditary. But after Dr. Duffin examined her, we found that she had extreme tooth decay, and now needs to be hospitalized to have crowns put on. And she's 2. And
Did we talk about what caused this decay, the role of her diet?
right, just that, like, the sugary formula that she had, that she needs or needed when she was younger, and then apple juice with high amounts of sugar caused that. And that was hard because you think that you're doing the right thing by giving them juice and milk, and then here at 2 she has this really bad tooth decay.
Do you think if you had known the message of what causes tooth decay early, before her first tooth came in, it would have made a difference?
Oh yes, absolutely. I mean, if we would have known when the first signs happened, if we would have known that was tooth decay, we would have been able to control the sugar completely. We would have known that it increases rapidly, that it can go from a small cavity to a huge one in a month. And it wasn't until we saw the actual sign of a tooth breaking that we thought, okay, well, that's not right, she's 2. So
Have you been able to share this message with your other family and friends so that they can avoid this problem?
yes, and I actually was able to get some comfort through some of my family members who had that happen. Of course, I wish I would have known their story before I found out about Emmy, but I've been able to tell my friends, like, Happy Meals at McDonald's, get the apples and the white milk. And that's a small step, but at least it'll help.
Well, thank you. This is a photo of a young child who is being treated in the hospital for massive dental disease in most of her teeth. It is clear upon careful inspection of the photograph that this is a repeat hospital case. The first attempt to treat the disease was a failure, most likely because the high sugar diet did not change and attempts at oral hygiene were inadequate.
Okay. How long you've been treating your daughters with this risk management program that we have here in Sugarby?
You mean like for their teeth and dental?
Yes,
We've been
yes.
coming here for almost 4 years now.
Okay. And when did we start doing the risk management program?
Last year?
Okay. And you see a big difference in the behavior towards coming here?
Definitely, yes.
And would you recommend it to somebody else?
Yes, I would.
Especially dentists that are not
Yeah,
aware?
it's a lot easier, less people, and the kids love coming here.
Open as big as you can. Ah! Good job. Open. Can you retract your cheek? Yeah, there you go.
Go ahead.
Okay, open. One more, okay? You're doing so good. I can see, yeah. Yeah, I know. Yeah. Good job. There we go. That's perfect, doctor.
Go ahead. Okay.
Thanks, doctor.
Okay.
Thank you.
The changes I saw at Shoreview Dental between the first and second year after we implemented the caries management program were dramatic. Prior to the program, we saw a lot of emergencies, after-hours calls, papoose cases, and there were so many hospital cases that we were booked out 4 to 6 months. We were even seeing repeat hospital cases. In the typical Medicaid office, the phone is ringing off the hook and there are more than enough people to see. That hasn't changed. But after we implemented our caries management program, we noticed that we could see more people in a day. The stress level was lowered, which parents really appreciated. We could minimize phobia with atraumatic care. We saw a reduction in hospital cases, and we saw children go from emergent situations into healthy, stable environment.
This patient was able to arrest all of the active dental decay in his mouth by simply improving his oral hygiene and changing his high sugar diet. Okay, so how are we doing with our sugar?
No candies, no sodas.
Excellent. And does he tell people that he doesn't eat candy and soda on his own?
Yes, today he told his doctor he don't can eat candies because dentist said no.
Good for you.
What does the doctor ask for you today?
You want a lollipop? And I say no, I don't eat candy. I'll say a sugar-free one.
Okay.
Good for you. Congratulations. Your cavities are all dead. Healthy teeth. Now we've got your microscope all set up with your bugs. Let's go ahead and have a look. Let me turn the light on. Okay, look down in there and tell me what you see.
I see a lot of white stuff and it looks really gross.
Uh-huh. And can you see them swimming around in there?
Yeah.
Ooh, that's what's on your teeth.
That's disgusting.
So, are you going to brush better?
Yes.
Okay, thanks a lot. Here we go. Fluoride, Fluoride Varnish. Okay, that's good.
Dental disease, both dental caries and periodontal disease, is an infectious process. It's caused by bacteria. And we have gone about restoring the damage that the bacteria has done. We go to the mouth like carpenters to a burning house, restoring the bedroom and the bathroom, remodeling the kitchen while the house is still on fire. Wouldn't it be wonderful if we figured out a way to bring out the firemen first, stop the disease process, and then spend the bulk of our time restoring the damage that's been done?
One of the biggest things I discovered is that in the low-income population, and especially the immigrant population, they have the same beliefs that we had in the 60s. Why take care of baby teeth? You're just going to lose them anyway. And there isn't anything you can do about cavities in the permanent teeth. And then I realized that in our profession, we are not telling people the things that they have to hear.
Treating cavities in young children is particularly difficult. Anxieties related to traditional treatment can lead to adult dental phobia. Restorative care for cavities in young children can be expensive, as many of these children must be treated in the hospital, with medical teams and general anesthesia at great societal cost. Children are trapped in a vicious cycle of disease, pain, and unpleasant experience having a tooth removed. The prevention practice breaks this cycle by promoting atraumatic and minimally invasive treatments which are focused on treating the infection that causes cavities. Once I discovered that there are effective treatments to arrest caries, the experience that my patients and I are having in the office has improved dramatically. Children that did not want to open their mouths and cowered at the prospect of going to the dentist now are perfectly happy to jump up into the dental chair and open their mouths wide to allow us to place medicine on their teeth. I'm here today with Dr. Marco Gutierrez, who's an associate dentist in the Shoreview Clinic. He's been involved with our caries management program for over 3 years now, and so we'd like to hear his comments about our program. Thank you, Marco. So Marco, could you tell us a little bit about your first experiences when you came to this practice and saw that we were using medicine to treat caries rather than drills and needles?
I was skeptical. I wanted to see it before I believe it, and through the years I tried it, and it works. It's just amazing that something, just a small amount that you can just apply to the tooth and the caries is arrested. I never seen this, like something like this before, and I'm sold for sure.
So how many cases do you think you've treated?
Thousands. It's just 3 years, and we see a lot of patients. It's nice to be able to address the infection of this disease that nobody has been able to address appropriately. I believe that restoration is just not the result, and it's not the answer. We need to address the infection first before we deal with the effects of the infection, and this medication does it. It's just a miracle come true.
Great. Well, it sounds like it's made your life a lot easier as a practitioner. And how have your patients responded to this form of treatment?
Well, I've been thinking of how this approach has affected my clinical aspects of treating patients. And for me, treating a patient is giving them the best experience that they can have. And I kind of compare myself to the movie Patch Adams. And if I can give a good experience to a patient, I do anything. And this medication has been able to help me provide that service for them, and to get him to the point that they're nervous and anxious to be joking around with me, and I'm just speechless.
Well, thank you. It seems to me that this process for managing caries is scientifically and medically sound. It's based on the biology of the disease, elimination of the infection prior to restorations. It seems to me to be well accepted by patients because we're able to atraumatically stop the infection and, if necessary, place restorations atraumatically as well.
Yeah, I'll say 90% of the time I don't even have to use an injection. Again, that's something that I can provide better experience to patients. I don't think myself I like injections, so therefore I'm pretty sure that my patients don't like it either. And to be able to do a restoration, I mean, big restorations that when I first started is like, there's no way I can do a restoration this big without an injection. And I have done it many times.
How close to a pulp can you get in terms of arresting caries in your patients?
Actually, I was looking at a chart this morning, and there was one, if you would open it, it got into the nerve. And I put the medication, put a temporary filling, and it's been a little over a year, and patient's asymptomatic, filling is doing good, patient's doing good, two's doing good. You can see a secondary dent forming, therefore it has worked. We just go back and fill it, and that's it.
So if we get rid of the infection, it gives the tooth time and the nerve time to heal itself, basically.
Yeah. Somebody told me sometimes we get involved with it too early, that we don't let the body heal itself. And with this medication, we are able to provide some time for the body to let it take care of it itself.
Do you think that other dentists are going to be able to quickly learn and embrace this approach to care?
Well, first of all, you have to be open-minded. I'm not sure I was going to accept it myself, but you have to try it in order to see the effects, like anything else. But as long as you're open-minded, you're going to see the effects of it, and you're going to like it.
What's amazing is that the literature supporting using silver ion as an antimicrobial agent is more than 100 years old and well established in the dental literature. And by adding a relatively new ingredient, fluoride, to our protocol, we are able to come up with a combination that is extremely effective.
Very, very effective.
Any parting comments you want to share with our colleagues before we finish up today?
It's just start enjoying dentistry, because this is the miracle of dentistry.
Thank you, Marco.
Thank you.
All right. So we've been doing this for 5 years or so. So we have hundreds, if not thousands, of kids in our program. I know that you've seen many of them. So,
yeah, especially I see a lot of post caries management, and also some kids in the middle. So you see what was started, what's the end result, which is nice, and it's quite amazing too.
Do you think that we have enough history to suggest that this is an effective treatment and that we should be promoting it to the profession for consideration?
I think so, and especially when there's a tool that you're aware clinically is working. For basically, you're working on both ways, not just dental disease and also behavior problems.
We focus our efforts on disease prevention. Children today can grow up with no more cavities.
Working together, we can all come one step closer to having Oregon's children cavity-free.
By working together, we can all help our children grow with no more cavities.